Welcome to Practical AI in Healthcare, the podcast that cuts through the noise to spotlight real-world solutions delivering real-world value. From patient care to clinical research, from life sciences to patient engagement, we focus on what truly matters in healthcare today. No hype, no theory, just practical insights where AI is making a true impact. Dr. Stephen Lapkoff and Dr. Leanne Rosenblit are your hosts as we explore what's real and moving the needle in this exciting new domain. Welcome aboard and let's get to it. Last September, the DCI network hosted its inaugural Signal Through the Noise Healthcare AI Conference in Boston. It brought together healthcare delivery leaders, technology innovators, government officials, and engaged patients. We explored some of the most important real-world use cases in healthcare AI. This year, from September 23rd to the 25th, we'll reconvene in Boston for the next chapter, Signal Through the Noise, From Proof to Practice, Scaling Enterprise AI Across Healthcare Systems and Biopharma. The question this year is simple but urgent. Once we found the signal in the noise, how do we turn promising AI pilots into sustainable, trustworthy implementations across the healthcare ecosystem? If you're a fan of the podcast, we'd love to have you join the conversation live in Boston. Podcast listeners can receive 30% discounts on their registration with the discount code PracticalAI30. Come join us this September for Signal Through the Noise, From Proof to Practice. We hope to see you there. Hello, and welcome to this week's edition of Practical AI in Healthcare. My name is Dr. Stephen Lapkoff, and I'm here as I am every week with my co-host, Dr. Leanne Rosenblit. How's it going, Leanne?
Oh, great, Steve. I'm really excited to talk to our guest today.
So, in terms of our guest today, we have a woman who I met sort of by chance through a friend last year. Her name is Chris Dymek. And how I met her is part of the story, but her background is much more interesting in how we met. Chris started life in the world of philosophy, moved into computer science, and then later into healthcare informatics, and ended up at AHRQ. And we're going to hear her whole story. And what we're going to talk about today is the topic of AI literacy. And why would somebody from AHRQ be interested in this is what we're going to unfold today. Chris, welcome to the show. How are you doing?
Hey, I'm doing well, Steve.
So, Chris, why don't we start as we tend to start our episodes by asking our guests sort of their hero story. How did they get their cape and their superhero costume? So, what's your background? How did you get where you are today?
Well, I'm not sure I have a cape, but it's a long and winding road kind of story. So, right out of my undergraduate degree in philosophy, I went into graduate school in philosophy. And after passing my doctorate exams, decided that rather than spend another year or two writing a dissertation, I needed to earn a better living. And my friends who were getting their doctorate degrees and getting just like 1 or 2 year appointments at places I would never want to live made me think I needed to move on. So with my interest in philosophy of language and logic, I thought it would either be computer science or law school. And I opted for computer science because I thought, well, this is sort of, a new, interesting, up and coming field. At that time it was. And, it might be interesting to just start working in it and see if I liked it. And with a few classes under my belt, that's what I did until I finished my degree. And then I started working as a programmer analyst and a systems analyst in various kinds of industries. I started off actually in medical situations. I worked at the medical hospital at the university I was getting my degree in, and then worked in retail and utility settings. And it was in the utility setting that, I became really interested in using information technologies to actually re-engineer business processes. And I became the director of re-engineering at that organization based on that interest and some of the work I was doing in that regard. But I realized that in order to be more successful in the work I was doing, I really needed to understand something about human behavior. So I ended up working on a doctorate in organization change, which encompassed fields like org behavior, org development. And, that really helped facilitate the work I did. And it got very important with respect to the work I ended up doing in healthcare too. So the healthcare story is an interesting one. I got an offer from a small healthcare organization in Tucson, Arizona, where I was living at the time to become their chief technology officer. And so I took it because I thought, well, this is interesting. It's going to be an interesting change of pace. And as I worked in that organization, it became really apparent to me that healthcare was really far behind the eight ball, so to speak, in terms of use of information technologies. So it became my mission to bring healthcare information technology prowess to the healthcare industry at that point. Now, from that position, I ended up working on implementing an electronic health record system for a large healthcare system in Maryland. So I moved to Maryland. And then the HITECH Act of 2009 came along, and all this money was released to implement electronic health record systems in the country. So after I did my stint implementing the electronic health record system, I actually moved into healthcare research organizations like NORC at the University of Chicago. And then eventually I moved to Westat, and through those venues, got an offer to become part of the federal government to implement patient-centered outcomes research data infrastructure. That was with the Assistant Secretary for Planning and Evaluation's office. They got a portion of the patient-centered outcomes research trust fund money to work on data infrastructure. And from there, I moved to the Agency for Healthcare Research and Quality and became their Director of Digital Healthcare Research. So long and winding road, but
it is a long one, and you ended up in a really interesting place. And that's where my connection to you started, because a friend of mine named Joe Bormel, who's been a fan of the podcast and has been helping us feed us a few guests from time to time, connected you and I. I know you had an unfortunate issue with the current administration, as it did most of AHRQ, unfortunately. But maybe you could unpack that issue a little bit, because it impacts what happened with the data literacy work. And even before that, when we even get to the question of data literacy and why this is important to AHRQ, or why it was important to AHRQ and you in particular.
Yeah, that's a good question. There's also a bit of a story behind that too. So
sure.
Back in 2017, I don't know if either of you have heard of the Jason group.
Yes.
Of course.
Yeah.
Oh, okay. Terrific.
Yeah, I mean, well, their findings were instrumental to framing FHIR eventually as the interoperability standard, right? Because they kind of pointed out what the problems were. So, I mean, they've done a lot of stuff, but that's probably how I know most about how I know them most.
Right, and that was my familiarity with Jason at the time, back in 2017 when I started working with them as well. They had said you need APIs for electronic health record systems, and that led to a lot of the FHIR development work. But at any rate, the Jason group started after World War II, and they have a lot of luminaries connected with them, even Nobel Prize laureates. And they were primarily working for the DoD early on, but they were taking some interesting questions from HHS, and one of them led to that work that you cited with respect to APIs and FHIR development. Well, we posed, and by we, I was able to partner with the Office of the National Coordinator and the Robert Wood Johnson Foundation shortly after I came to AHRQ to ask Jason if they would consider looking at AI in health and healthcare and take on some questions we had posed to them in that regard. And they did. So, I had the privilege of working with them, and they said a lot of things. One of our questions was, is this just a passing fad? Well, they clearly articulated reasons why it was not just a passing fad, that AI was not, something that we had reached a hype cycle on. This was going to keep going. But through that venue, I really became interested in AI research in the position that I was in at AHRQ. And Jason said, the report is available. Anybody can take a look at it. But one of the key things they pointed out was that good data was going to be part of the issue with moving AI forward in this country. And so I was interested in thinking about how I at AHRQ, through the position I held, could help promote that, and also research into looking at the safety of AI, and not only the safety of AI, but also how it could be validated, because Jason, that report for us, pointed out that we would really need to work hard to ensure that the guardrails or peer review that was necessary for clinicians and folks in healthcare to buy into whatever AI produced was going to be valid and good. So I was thinking about how I could influence that in my role. And I started, funding AI research proposals that came our way to AHRQ and my group in particular. And that led to a concern about safety. And so I collaborated with a patient safety group at AI to put out a funding opportunity to examine the safety of artificial intelligence in healthcare organizations. And it could be positive or negative. And at that point in time, ambient AI systems, for example, were becoming popular because of the concerns folks had with, physician burnout. And the thought was that AI ambient documentation systems would help with that. So at any rate, we put out this funding opportunity, and that led to a concern about AI safety in writ large in healthcare organizations. So we decided that, since AI could be used in various ways, that AI literacy was going to become very important. So my team and I we started working on a request for information, or an RFI as it's known in the federal world. And we wanted to go to organizations directly, because at that point in time, there wasn't much research done on AI literacy and how it could be promulgated or whether it was even used at all. So we decided we would go to healthcare organizations and put out questions to them about, how they might be using it, if they weren't using, AI yet, and they thought about literacy in their organizations. What were they thinking about it? Did they think that there were certain groups of folks in their organizations that needed to be AI literate and not others? Like, for example, we thought that folks who were purchasing or governing AI applications in their organization would need or be a good target for AI literacy, as well as folks who were using AI directly in patient care. But we wanted to hear from the organizations directly. Needless to say, the RFI was never published. And then I left the organization in May of 2025. There were lots of, people leaving AHRQ at that point in time.
But it's really cool that sort of you and Steve were able to pick up that work under the DCI network banner. I think it's really exciting that the work didn't just stop, but you said, this needs to get done. And I just applaud you guys for running with it, because I think it feels like a very important moment to emphasize AI literacy. But I wanted to come back to you, to tie your background a little closer to the current work. I'm a cognitive scientist, and you and I could bond about sort of philosophy of language stuff. But tell me how you think about this. How does your philosophy of language background let you see in AI something in AI that an engineer might miss?
Well, engineers are very practically concerned with cause and effect. And I think, given the philosophy of language background that I have, first of all, you and I have talked about Wittgenstein in the past, Leon, and I remember something Wittgenstein.
I try to talk with everyone who will listen, but
and he's always talking about Wittgenstein. He's got a thing about this guy. I don't know.
Well, and something.
He's only part joking, unfortunately, but
something struck me very early in my work, which is that, and this I'm paraphrasing, of course, but it stuck with me. Whatever can be thought can be said, and whatever can be said clearly, right? So with that framing, I think about in general, not just around AI literacy, but anything digital or computing wise in general, because to digitize things, you need to make it very succinct and very clear. So thinking about that from that kind of philosophy of language perspective, and how you say things have implications for how you view them and how you implement them, it is just, something that I always keep in the back of my brain. And so I think, when I think about AI literacy, I think about literacy writ large, and how that affects things.
So let me press on that a little bit. I'll set as a sidebar that a cognitive scientist and a philosopher of language might not agree on whether all thought is language. I don't know if I completely buy that. No, but I accept, I think, part of your point, which is that the way we speak and the way we represent things in language absolutely influences how we think about them, which I think where you're going. And I think that sort of
worldview.
right. So so you're like a strong Whorfian, right? If we want to get down into the theoretical language, but I mean, I think that sort of that we can turn that back onto the question of what AI literacy actually means, right? And I think we talk about AI literacy. I know we do for practical purposes, as if we all agree. But literacy is a metaphor, right? It's something that it was a historical process that's well understood. And by saying this is like literacy, we're making some assertions about how things really are. Now, you draw a sharp line between knowing that and knowing what. Can you unpack that for us and help us connect that to your thinking about what AI literacy actually is and why book knowledge may not be enough?
Yeah, thank you. So, knowing that, I consider being, just knowing some basic facts about AI, like what's the difference between a large language model and, some other types of predictive modeling, and what's agentic AI. So just knowing some basic facts about AI, knowing that there can be some risks associated with AI, like hallucinations, knowing that there are ethical implications around the use of AI. There could be bias in certain AI systems. So that's what I call knowing that. Just things that you can get from either your own reading or going to a classroom where these kinds of things are discussed. But knowing how is different, right? I mean, to know how to use those kinds of facts in practice is very different. And I think about financial literacy, for example, as an analogy, right? I mean, I may know that I have to reduce debt and increase savings, but to know how to do that is a very different matter. And some people hire financial advisors to help them know how to do that, or actually do it for them, since they don't know how. So,
Yeah.
I think it's going to be important for people who are, especially in healthcare, to not just know that, but also to know how to use AI in healthcare. And you can do that in various ways, by simulations, by practice. So there are different ways that you can actually.
So Chris, let's tie that down to just to a practical use case. Give us a version that a skeptical clinician might push back on. Why they would say, well, wait, why? I'm a smart person, I'm educated. Why can't I just read a one pager and be AI literate? Just tell me what it is.
Yeah, sure. So, I mean, I actually started out that way, right? I just
Right.
started, learning via classroom learning. But until I actually, and I'll use a large language model, for example.
Mhm.
Until I actually started writing prompts to answer my questions that I had, I didn't know how to do that effectively. It took me some practice. And then I would read up some more about it, and then practice some more with regard to the questions that I actually had. So,
Yeah.
that can apply to a clinician too, who's
Yeah.
to look up, something around a difficult diagnosis. And, so the way you ask the questions, the kind of data that you supply is also going to affect the answers you get from a large language model.
Yeah.
Is as
Go
a
ahead, Steve.
yeah, I was going to just say, I think this distinction that you're drawing here, it's an analogy I've used many times around not just knowing the book smarts, but you need to sort of grow into how to use these tools smartly. And I often point towards, you wouldn't give a medical intern, a colonoscope and say, go out there and go do a colonoscopy. They need to train and understand how the instrument feels in their hands and things like that. And they need to learn exactly how to use the instrument properly and safely. Likewise, I think a similar situation is here with becoming literate in these systems means effectively that's one facet of it. Exactly that.
I use a much less colorful analogy. I just say you don't learn to play the piano by reading music theory, but but Steve's version is definitely more memorable. Although, so what's the where does it go wrong when someone has the that but not the how, especially in healthcare?
Well, they can be duped.
Mhm.
right, very easily because they haven't familiarized themselves and taken a critical look at
Yeah.
what they're receiving. They can be, using tools that are biased because they haven't, familiarized themselves with how to detect bias and taken a critical look at AI systems. So, lots of things can go wrong if you don't know what you're doing.
Yeah, no, thank you. That was a really good exploration of the concept. Let me push on the historical analogy with literacy just a little bit more. So when we talk about electricity adoption, we don't talk about people becoming electricity literate when the electrical grid arrived. I mean, they certainly had to learn many things about how to use it effectively, but the literacy has its own application. And you've got a rich history here, right? You've got libraries. Literacy is a tool of elites that had to become more inclusive. It had to be disseminated more widely. Can be used to exclude others, right? By denying voting rights. Kind of, there's a whole shift from their agrarian to an urban commercial economy.
Right.
Can you make the case for literacy being the right lens for AI? And what does that framing actually buy us, and what does it cost us?
Yeah. So those are good questions. So with respect to AI literacy as opposed to, other kinds of literacy, I look at it as a response to the situation we find ourselves in. So, and I'll go back to the financial literacy example. It's more of a response. Financial literacy is more of a response now in an age where we might be losing Social Security. we might be losing, a lot of union folk. I'll use my mother as an example. She was a member of the UAW. She had worked for the Chrysler Corporation for many years. She never had to really worry about financial literacy to be secure in retirement. She had a UAW pension. She never worried about getting her Social Security. That was secure. But folks now, like my daughter, has to be very concerned about financial literacy. So that's a response to the current situation. So for me, AI literacy right now is a response to our current situation. And by the current situation, I mean we've got, a lack of guardrails in place, if any, in this country. I mean, certain states are trying to do some things, but there isn't broad-based regulation. And, the FDA, while it does reviews for medical devices using AI, there really isn't, any other kind of federal regulation in place at this point in time. So AI literacy for me is a response to the risk involved with AI. We need guardrails in place. So if you have illiterate staff who can detect some of the risk involved with using AI applications in their organization, that's a guardrail, right? They're your first line of defense. And the other thing I think about when I think about AI literacy is it's not only a defense, but it could be a great offense too. One of the risks that's happening right now, not just in this country, but in the world, is that not many people are getting a return on their AI investments, not just in healthcare, but other industries too. So, if you have a literate staff, an AI literate staff, they can actually, and some of them will take that further than others in your staff. I mean, they will explore, you can create tiger teams of people who are really anxious to try new things, re-engineer processes. That's I have a background in re-engineering as well. So the offensive strategy here is to see how you can really make productive use of AI in your organization. So, the picture I've used in presentations about AI literacy before is, I think of a bowling alley, right? Think of the guardrails on the side of the alley and think of the pins that you can knock down and create a strike from using your bowling ball appropriately. So there's guardrails and there are strikes. And we need to think about, creating guardrails and strikes. And I think AI literacy effectively used in a learning health system can be that kind of guardrail and, strike producer for a healthcare organization. Hope that makes sense.
Yeah, no, I think, there I just want to point out, like what jumps out to me about your perspective is that you are embracing the rich implications of literacy and not being shy about it. It implies a policy response that can increase the level of literacy, and failing to do so will create situations where people are left behind and where insufficient guardrails are there to prevent harm, right? So I think that it's a strong position to take. And I honestly don't have a better word than literacy. So, one challenge to my question is like, what do you got that's better? And skill development, competencies, I'm not those carry a little bit less of that baggage, but I think I think you've answered my question really well, because you mean what you're saying when you're using the term literacy. You are actually implying that this should be treated like the way we treated actual literacy during the time. So thank you. And I know you and Steve worked on a literacy framework, so I want to make sure I give him the baton to ask a little bit about that and make sure our audience understands it. Steve.
Yeah, thanks. And so, Chris, I'm going to unpack the work that we started last September at the DCI conference, because honestly, while the concept of literacy was probably percolating in my brain, it wasn't labeled as such. I didn't really call it out as that was the moniker or the label to use. And then I met you, and all of a sudden it was like all these things kind of gelled. And, we worked together on building out this framework, and I think it was based on work you'd previously done. And maybe you could unpack what that framework looked like. We had various levels and users and so forth. Maybe you want to unpack a little bit of that for the audience?
Sure, I'd be happy to, Steve, because this is still developing for me too. But the initial
Yeah.
framework had to do with thinking of literacy at a healthcare organization level and at the healthcare professionals level. And I've recently been thinking about how to add patient and caregiver AI literacy to that framework as well. So at a healthcare organization level, healthcare organizations need to think about what AI means to their organization and what capabilities do they need in their organization to create the vision they have for use of AI in their organization. And along with thinking about the capabilities that they need in their organization to use AI effectively to enhance their vision of AI use in their organization, they need to think about the people in the organization who need those capabilities. So the way we began to think about it at AHRQ was that there needed to be role-based AI literacy. So when your organization is thinking about how you're going to use it and what the vision for AI is in your organization, what are the roles that are going to need to be thought about, and what are the work processes that those roles undertake, and you need to prioritize what those work processes are that can affect the use of AI that you're after in your organization. And I'll just give you a recent example that I've been reading about the Chinese use of literacy in healthcare organizations. And the Chinese have articulated a vision about having AI-assisted diagnosis as the treatments, and treatment as a standard across primary level institutions for 900 million citizens by the year 2030. So they have a vision for the use of AI in healthcare organizations in their country that they want to achieve by the year 2030. So, they've got a vision. What are healthcare organizations in this country vision for use of AI? Do they want to use it for diagnostic purposes? Do they want to use it for just administrative purposes, a combo? Life sciences may want to use it for drug discovery. So there are different processes and visions for how healthcare organizations may want to use AI. And they need to think about the workplaces that will need to incorporate that vision and the capabilities needed in that workplace. So at any rate, there's, that organization level where you create the vision, you create the processes and the governance connect it. And then you help with the workforce and help them become literate and develop the capabilities you need to affect that vision. Now, prioritization will need to occur, right? Because you can't do everything all at once. But the way I've been thinking about integrating patients and caregivers into that vision is that there needs to be a literacy model for patients as well. Many patients are starting to look up Dr. ChatGPT or Dr. Claude and trying to figure out, what their symptoms are telling them. And they're bringing that finding from ChatGPT or Claude to their physicians and saying, hey, I'd like to have a conversation about what I found here. So physicians who are dealing with patients at that level will need to have shared decision-making conversations around that. So people are going to need tools to figure out, how to have productive conversations around that. But, there are patient and caregiver literacy models too. There's, the knowing that for patients, they can also learn about what AI is on some basic level. There's the knowing how, functional literacy. They can figure out how to use Claude and other large language models effectively to look at their symptoms. And then there's a level that I call critical literacy, which means they can evaluate the trustworthiness and risks of what they're seeing. And then there's something that I call participatory literacy, which is what I was just talking about, where they can discuss AI in care decisions with their providers. I have a friend, for example, who has stage 4 breast cancer, unfortunately, and she has found that it's given her great agency to use large language models to talk about and formulate questions for her doctor about what she's currently experiencing and what she's going through. And then there's this last level, which I call empowered partnerships. And there's a thinker in this regard, a patient thinker his name is Hugo Campos. And he's recently written a commentary on critical AI health literacy with his companion, Liz Selmy, in this regard. And, it's about empowering patients so that they can actually co-create using AI-supported information with their providers. So, patients are going to be getting more and more sophisticated along the maturity line and integrating that with how the organization is in their organization. You've got the organization, what their decisions, and they need together to really create an effect that can productively maximize AI use in an organization.
So I'd like to maybe shift the gear a little bit to, the question of, you frame healthcare as a core tension really nicely. It's, we have the issue of do no harm. And we also have in the technology world, go fast and break things. And we don't want to do that in healthcare. How do we reframe this in our world in a way that we can keep these things moving at a good pace without doing any harm from your perspective?
Steve, you're going out for me. Sorry.
Yeah, we actually need to let's the last question had a little gap in it. I think it's fixable, but you just froze again, Chris. So
let me try. I don't know if it's me. I'm sitting here on my phone. Let me try to switch networks. I'm in a building and
I'm seeing it's on Chris's side more. I don't know if I'm the arbiter of truth and justice in the American way here, but I'm seeing more freezing from Chris than I am from Steve. So I'm assuming it's probably your network for reasons that we don't know. I think we got good tape so far, but I want to keep rolling. But what do you think? Is there anything else we could do, Steve? I mean, you could reboot.
Nothing I can do if it's the Wi-Fi. That's
okay.
That's
Can you guys hear me now? Okay.
Yeah. You only fade out for like 4 seconds. So, and if you do it at for just once in a while, then we can cut that out from the tape, or rather Steve can. It creates a little work for him, unfortunately. But if it kind of fades in and out, then it becomes very hard.
Really choppy.
Yeah. So you're back now. If you guys just want to resume and finish the question. Finish.
I'm sorry, you guys. I don't know what's going on.
No, it's not your fault. It's just IT, man. It's we're all dealing with the digital ocean, and the weather is not great right now. We don't know why. We're just surfing. So
let me roll it back to the last question.
Yeah, but you don't want to. I don't think you need to answer the entire question. It was. I mean, you gave a pretty. I actually lost track. I'm sorry. No.
I'm going to go back. I'm frozen now.
Yeah, now you're frozen.
Oh.
So Steve, maybe you better
try to. I've got another option for network here. I'm going to try to switch to that.
Try something else. Yeah, because I think it's a combination. I think you're seeing more freezing than I am. Chris, because you've kind of been pinging me, going, and I only saw her freeze 3 times so far, but it was not that big deal.
Yeah, Steve is frozen now.
Frozen now. But yeah, so you're doing great. These are all easily fixable IT glitches. All they'll happen is just look a little choppy in the video. On audio, you can't even tell, when you cut them out, because people speak in a pretty choppy way and usually just kind of display. But unfortunately, what happens on video is when you cut out a slice, it just looks like there's a little bit of a jump. So because we're not doing fade ins and fade outs. We're not Quentin Tarantino. No. Actually, while Steve was rebooting, I was curious about. You made a comment at the DCI conference.
So, Chris, thanks for that. You frame healthcare's core tension kind of nicely. In medicine, we don't want to do harm. We do no harm. It's part of the Hippocratic Oath. And we also don't want to go fast and break things, but that's kind of how tech is geared right now. But standing still also has its own costs. So what's the right approach from your perspective to maximize AI in healthcare while we're building the guardrails? Where do you stand with this?
Yeah, that's where I think my whole approach to AI literacy comes in, Steve, because it's not just about, as we discussed before, knowing that. It's about knowing how and actually using that knowledge productively. So to maximize AI productively in healthcare organizations, we're not going to go fast and break things, but we're going to use our literate folk and our literate patients to help us think about how to use it productively in a learning healthcare system. And there actually are. I was really excited to see the other day that UCLA, the healthcare system that I've become a patient in since I've moved to LA recently, is actually starting a center for looking at AI safety and implementation. And I'm hoping that they're going to involve patients in this center as well, because I really think that we can move it productively forward while having guardrails if we've got a literate patient population and a literate healthcare professional population supported by the organization who thinks literacy is important. So, again, it's not moving fast and breaking things, but using the people that are part of the organization to provide those guardrails and also the innovative ideas about how to move forward.
So, really quickly, Chris, when all this work was running and you were running things at AHRQ, it kind of abruptly stopped. The administration has stopped a lot of things in healthcare. The CDC's kind of gone pear-shaped as well. But tell us about how you've been able to move this work forward in a positive way, even though the sands have shifted and you're in kind of a different position at this point.
Yeah, so maybe just some background about how AHRQ was doing some really great work in health literacy for like about 15 years. AHRQ really made a dent in looking at how health literacy was tied to not only patient safety, but also health outcomes writ large too, which were in fact influenced by patient safety outcomes. So AHRQ did a lot of research to make that connection. So they funded research to make that connection between health literacy and outcomes. They also funded a lot of work to create toolkits, implementation toolkits for health literacy. So I was thinking about, a similar playbook that I could embark upon. Some of that I was hoping I could do with AHRQ funding while I was there. But now I'm thinking about trying to do that, external to the federal government and maybe work with some organizations down the road. The DCI network, of course, has been very instrumental in helping just increase the thinking that's going on about AI literacy, not just in my regard, but connecting people around how we can make this happen. Like Hugo Campos, who I mentioned before, who's working on critical AI health literacy for patients. He was part of the DCI network and made presentations. So just, creating the right synergies amongst people so that we can, create the thought processes that need to go forward around this. And we've also thought about actually creating an assessment survey through the DCI network. That was something that I wanted to do at AHRQ, and was thinking about, how do we create some tools for folks to assess basic health literacy and then keep assessing it going on as the field evolves. So there are things I've been doing with regard to just connecting with people, trying to think about next steps and how we can get funding for those next steps too. And a lot of it's based on the original AHRQ playbook around health literacy and connecting that to AI literacy, doing the research to connect the two, and that it makes a big difference in terms of patient outcomes, which is ultimately why healthcare organizations exist. And also thinking about creating toolkits and creating measures too. That's something that's really important in a healthcare organization. What are we going to measure when we create these assessments of health literacy? What are we looking at? And a learning healthcare organization will use that virtuous cycle. You'll collect data against the measures and the tools that you're implementing to see if these are working or not. And then you adjust as needed. So, I'm hoping to effectively, think about that strategically, but then actually work practically in a healthcare organization at some point. So I'm trying to find that connection now to actually do that. And, I think there's still an obligation on the part of the federal government with certain funding to help support some of these things. So to look for opportunities for applying for grants and things of that sort to fund some of this work.
So, I want to thank you for being a part of the network. Both Leon and I are and Yura Quintana as well, are very grateful that you've been taking this on with us, and that we're able to help give you a platform here. And we're looking to get some funding for that survey that you mentioned. We'd like to see that advance. We do have a paper that's in process right now. It's under review at JAMIA. We haven't heard back yet that it's accepted or up for fixing or whatever, or modifications. Hopefully no news is good news, but I do want to say thank you for all that work. I'm going to hand it back to Leon, and we're going to start getting towards wrapping up.
Again, thank you for the contributions. And by the way, glad you mentioned Hugo Campos. We just had him on as a guest 2 weeks ago. So you guys are in parallel tracks. I want to bring it to the practical side for our audience. So as a health system leader who's listening to this and who says, I'm convinced, Chris, literacy is it. Now what do I do? What are the first real moves to build AI literacy across all the 3 circles that are in your model? And how do we know it's working?
Yeah, so that's a great question. So I mentioned before that it's important, I think, for a healthcare organization to tie AI literacy, if they can, to their strategy, right? What's a strategic goal that you have with respect to AI use in your organization? And what competencies are you going to need in your organization to accomplish that goal? So those are some key original steps. And then create the platforms, the learning platforms for your staff to actually, achieve and realize the competencies that you need them to achieve for, doing that work in your organization that will achieve your vision. And assess organization facilitators and barriers along that path. So, are there existing digital literacy efforts that are ongoing in your organization that you can append AI literacy efforts to? That can be a potential facilitator of doing this work going forward. Or are there barriers? Trust is typically a huge barrier in an organization with implementing AI literacy or AI writ large. You've probably seen the commencement addresses that have been going on across the country recently, and people are up in arms when speakers are talking about AI and in their future of work at commencement, at graduation ceremonies. People are sometimes even walking out. But so trust is a big issue with bringing AI into an organization. So working on that aspect too is going to be important for an organization that really wants to maximize AI use.
I wanted to press on one issue that we talked about earlier. It's a library analogy. right? So when you think about literacy and you think about what institutions and policies have really helped to advance it in liberal democracies, it was the development of institutions like public libraries and public education. What's the institutional answer to AI literacy that lies outside of organizations who are trying to solve it for themselves?
Yeah, that's also a great question, something I've been thinking about. So, um, the European Union, for example, has an AI literacy group, and they've actually put out an AI literacy toolkit to collect best practices around AI literacy implementation. Um, I don't know what the answer is in this country, frankly. I mean, I don't see the
Yeah.
appetite yet for that kind of national work, but we can ask for it, right? I mean, we can try to eh, maybe think on a local level or a state level to try to create the toolkits that are going to be needed. And there are, healthcare organizations that are more resource rich than others. And maybe they can be a force for good here and sharing some of the tools that they're putting together. I know that the specialty societies groups are banding together, and I heard several months ago that they were asking CHAI, the Coalition for Health AI, to help them develop trainings. So maybe those can be shared broadly. How can we make use of the collective that we're all trying to work toward to share these things? I don't know what the answer is. I do know, and I had the interest to look at the HHS AI strategy recently for some work that I was doing. And HHS has, as part of their strategy, doing role-based learning for the folks in their organization around AI, because they know that to achieve the AI usage that they want across HHS, they're going to need AI literacy based on roles in their organization. So whatever HHS is doing, maybe that can be shared too.
So, yeah, Chris, just need to get push us to wrapping up. I mean, I think you're doing a valiant job of trying to answer a question, but it's fair to say none of us know what the answer is, but it's nevertheless really important that we start asking the question. And the way you framed it is really helpful, right? Which is, what are the institutional and cross-institutional responses to the AI literacy problem? And we need to acknowledge we don't know what the answer is right now, right? But boy, are we on board with trying to ask. So I think this was just such a rich discussion. I'm going to try to summarize what I've heard so far, and just for to help us walk away with some take-home messages. I mean, first is that AI literacy isn't just a pamphlet you hand to somebody. It's a knowing how that's earned by doing, right? It's learning to play the piano, not reading a book about music theory. It's not one skill, but I think you've done a nice job of parsing it out into 3 literacies. There's patient, professional, organizational, that are on a ladder that tops out a genuine partnership, not mere tool use. And I also think that you've reminded us that the tension is real, that do no harm and move fast and break things, our intention. And standing still also has a cost. And it's the guardrails are what let you move fast safely. The way the bumpers allow you to be more confident when you bowl a strike. The unglamorous part may just be our old friend, the learning health system, right? It's measure, build, evidence, adjust as needed, right? And the work at AHRQ started, didn't die, just moved on, because that work remains really fundamental. So, I mean, the human stakes here, this may sound really theoretical, but the human stakes here remain really high. Is that AI literacy right now is how patients and clinicians stay participants in their own care and not bystanders. So I just want to thank you for a really thought-provoking discussion. I want to thank Steve for joining, and our audience as usual for listening. Chris, where can people learn more about your work if they want to follow you?
They can look me up on LinkedIn. I post a lot there about things that I'm doing.
Fabulous. So I hope we all of our listeners do that, and we look forward to seeing you all next week on another informative episode of Practical AI in Healthcare. Thank you, Chris.
Thank you for joining us this week on Practical AI in Healthcare. If you're ready to go beyond buzzwords and hype and explore how AI is truly transforming healthcare, stay tuned for more conversations that get us to what works. Until next time, stay practical.